The Radiation Protection Institute is one of the 7 institutes of Ghana Atomic Energy Commission. It was established to work in the area of radiation protection to ensure the protection of human health and the environment from radiation. It is a scientific as well as a technical supporting organization. It therefore carries out research activities and provides scientific and technical support service in the area of health physics, occupational radiation protection, public exposure control, nuclear safety and security, and non-ionizing radiation protection. It has obtained the relevant authorization for the Nuclear Regulatory Authority to carry out these technical services. It also collaborates with other state institutions to shape the national radiation protection policies in the country. In order to carry out these tasks, the Radiation Protection Institute is structured into 5 technical scientific centers, namely the Health Physics Center, the Environmental Radiation Protection Center, Nuclear Safety and Security Center, the Waste Management Center, and the Radiation Protection Training and Consultancy Center. These centers comprise of scientists and technologists with well-defined programs and activities.
The Nuclear Safety and Security Center has positioned itself to be a strong force worthy for the provision of services and research activities. Some of our research strength has lied in the development of the awareness and advocacy in the need for the protection of the materials that we work with at radiological facilities and at nuclear facilities. We have in the past conducted the Search and Secure projects with the Office of Radiological Security of the United States of America, held training sessions, and of course completed the complete awareness of the advocacy for companies such as Conship and Amandi Limited. Some of these advanced companies are stakeholders in our industry, assisting in the transport and maintenance of the need to protect these materials of concern. We are on the quest to make sure that we bring these peaceful applications to the doorstep of all stakeholders and make sure that the adaptation of the culture needed for protection is well adapted. So we have done this and we can do better. So our laboratory, the Physical Protection Laboratory, the advocacy in the security culture is one of the key areas that we have actually promoted in the past. We know that this is a big challenge, especially for a developing country like ours. So we make sure that this is well advanced and as yet well adaptable for the people of Ghana. The Republic of Ghana depends on us, so we've positioned ourselves to deliver. Our quest now is to make sure that all of this is well adapted by the Ghanaian populace. Protection is key for us, and we shall protect the people who have signed on to work with and deal with the handling, the use, and storage of the radiological materials and nuclear materials that are of key advancement in the technologies that are well adapted worldwide. This is what we seek to promote, and we shall deliver.
The Environmental Radiation Protection Center, which is one of the 5 technical centers of the Radiation Protection Institute. The institute is involved in environmental radiation protection for protecting people and the environment from ionizing radiation. As the name goes, the main activities of this center include radiological water safety assessment, environmental assessment, food contamination tests, mostly for import and export, and natural or radioactive material assessment for industrial processes that involve particularly in oil and gas industry as well as mining and processing industries. Yes, most of these activities either are a way to complement regulatory compliance for various industrial processes or to serve as research and development to protect overall public safety and the population of the country. Regarding to current main activities or projects that has been embarked on within the last 2 years, we've embarked on research to ensure overall public protection in the area of water quality and in the Bono region, assessing the Tano River and its access to public points, as well as general groundwater that is used by the public to ensure their drinking water quality in terms of its radiological aspect. We've also embarked on projects like assessing, putting up the first norm repository, which is in a PhD research, to ensure that waste that comes from these oil and gas industries as well as mining companies will have a way of properly being disposed of. Additionally, the center is equipped with the Radon Lab, which is one of the best equipment so far only in Africa, the only facility in Africa, which is used to complement indoor radon assessment for dwellings, as well as in mines underground, where its confined space and ventilation are not well, and most cases radon is prevalent in such areas. So all this we do to overall ensure that the public is safe when it comes to ionizing radiation in the environment, and then also to assist those stakeholders in most cases to meet regulatory compliance as demanded of them by the Nuclear Regulatory Authority.
The Radioactive Waste Management Center was established by the Ghana Atomic Energy Commission in 1995 to manage all the radioactive waste that are generated in Ghana in a safe and secured manner to protect human health and the environment, so that we don't impose undue or unnecessary pressure on future generation in terms of the hazards that are associated with these hazardous waste. So currently, the center provides technical or commercial activities to various clients that use radioactive materials in their practices. And most of our clients are essentially from the industry. So when you talk of industry, we are talking of the construction industry, oil and gas industry, the mining industry, breweries. So most of them use the radioactive material in the form of sealed radioactive sources. So once they get disused, they pass through the Nuclear Regulatory Authority and then transfer custody to the radioactive waste management. Thus, if they are unable to return those disused sealed radioactive sources back to the country of origin or the suppliers. So once we receive all those radioactive waste, we then go through a series of management processes to take care of this waste, handle every aspect of waste up to the point of disposal. Currently, we are undertaking the borehole disposal system project, which is the ultimate option that we are considering to permanently dispose all radioactive waste that are in our custody, which, like I said earlier, are predominantly disused radioactive sources. But prior to carrying out the disposal, we go through some management steps that we call pre-disposal. So when we receive the waste from the generators, we first of all identify key properties about the waste, which we call characterization using appropriate instrument. So the information we get, we compare it to whatever document that accompanies the waste from the generator. Then once everything is in place, we temporarily store those wastes at our centralized radioactive waste management facility, which is located on the GAEC site.
I am Dr. Philip Datana, the manager of the Health Physics Center Radiation Protection Institute. Within the Radiation Protection Institute, there are about 5 technical centers, and Health Physics is one of the technical centers. Now, within the Health Physics, there are departments that falls under the center. These departments are the Secondary Standard Dosimetry Laboratory, simply called SSDL. We have the Non-Ionizing Radiation Safety Department. We also have the Personnel Dosimetry Services. And then finally, the Equipment and Repair Maintenance Unit. Under the SSDL, which is the Secondary Standard Dosimetry Laboratory, we perform the following services. Calibration of equipment. This is a practice that is to ensure that all the equipment within the country which are used in the radiation fields are calibrated such that they meet international standards. SSDL is traceable to a primary standard just to sure that the standards are well maintained and such that people who use this equipment can be accurately monitored. The SSDL also perform other activities. It is a center of excellence for training students within our institution, the Graduate School of Nuclear and Allied Sciences. We receive fellows from our sister African countries who comes here and be trained in order to upgrade their knowledge base. We also receive experts who also comes here to participate in training of other participants within IAEA's scope of workshop and training. Under the SSDL also, we participate in an intercomparison exercise, which also is a very important exercise just to make sure that we compare very well with other sister SSDL or network of SSDL within our region and beyond. When it comes to the field of radiation protection, we expose radiation all over, all around us. In order to ensure that those who are actually working in these areas, who are occasionally exposed to these radiation fields, are well protected and monitored, we provide these services. These services intend to estimate the radiation dose one is exposed to, such that when there's an incident in the future, experts can rely on this data to make sure that it's as a result of your work or otherwise. So this is a service we provide, which is very important, and we keep record for so long, about 70 years, even when you are dead and gone, just to make sure that you can work comfortably, and in case of anything, we can provide evidence. Within the non-ionizing radiation, we perform the following services. We make sure that this mobile telephony antennas complaints from the people who stay within the vicinity of these antennas, and emission from these antennas are well within standards. So we go around with our state-of-the-art equipment, spectrum analyzers, and our well-trained staff to conduct safety assessments on these fields to ensure that they are well protected. We compare our standard to international standards to meet regulatory compliance. And when it comes to this area for the base station monitoring, EPA is our regulator in this space. Within the non-ionizing, we also perform light safety assessment, where we make sure lights such as ordinary light bulbs in our rooms, light intensity in our rooms, UV radiations, we'll be able to monitor and then advise as to the optimum emission level, which is suitable to protect our visions, our eyes, when it comes to radiation exposure. Because when it comes to radiation, one thing we forget is that light is a source of radiation, which we are exposed to. We are much concerned about mobile base station and the like, but light is one that we are always exposed to, which must be regulated. So we make sure that we are able to estimate and advise the optimal radiation intensity one is supposed to expose to in an office space or within the environment. We also make sure those who live within high tension, extremely low frequency fields, we call ELFs, are also well protected. So we perform services in these areas such as ECG, grid core, transmission lines, etc., to make sure that the exposure there are within the recommended. Otherwise, we advise the occupancy to vacate those areas. In order to make sure our equipment are in shape and well maintained, we have a final department or department that deals with repairs and maintenance of these equipment. So this unit or department make sure all the equipment within the institutes are well maintained and well protected when it comes to maintenance and service related. So within the Health Physics Center, these are all very important services we provide just to ensure that radiation protection of the people and the environment is well achieved.
My name is Dr. Francis Otu, the manager of Radiation Protection Training and Consultancy Center. This center deals with training, safety assessments, as well as drafting technical document for the authorization for licensee operators looking for authorization from Nuclear Regulatory Authority. When we come to the training, what we have been doing is that we have been normally organized national training for radiographers for every year that we have been going. This year we are going to have it in October. So we definitely send a lot of information and advert into the facilities and then associated hospitals and then also Ghana Health Service. And then when it comes to the training, the main target of the training is for occupationally radiation exposed workers. And this target covers industrial and the medical. And industrial involves mines, oil and gas, road constructions, and then also NDT, non-destructive testing the workers. So what the training does is that the training teaches them how to handle radiation sources and also understand the risks associated with radiation that they are working with it. So with this training that we have been doing is to do only for the radiographers, X-ray technicians, and then also engineers. But then based on the output that we are having, we have decided by next year, we are going to start the medical training, but not only focus on X-ray or radiographers, neither the engineers. But now, the target is going to be the managers, administrators, those in charge of the hospital. The reason being is that most of the issue we are getting that the information doesn't get to the managers or the administrators or heads of the hospitals. So sometimes it's very difficult for them to attend this. And so what we are going to tackle them first to create awareness for these managers and heads of the hospital. The reason is that so when they understand, they will truly appreciate why the training is very important for the X-ray technicians, radiographers, because they are the people that we call it occupational exposed workers. These are they are working directly with the X-rays, so that will be very important. And then we're also trying to expand this training to cover every aspect of Ghana. So what we have been doing, we only done all this training in Accra, but next year we are going to move outside our comfort, that is Accra. We are trying to have one in western part and as well as northern part. We are even targeted to have it in Kumasi or Takoradi, so that we can get those hospitals very close, and as well as those in the north, everything in Kumasi, and from there we see the way forward.
Advancement in nuclear science and technology has opened a new horizon in radiation application in medical practices, agric, research, and industrial activities in the country. In order for us to derive the maximum benefits, we need a very strong radiological safety culture to enable us to derive the maximum benefit from these practices and minimize the harm. The Radiation Protection Institute, with the aim of being recognized as a leading national, international institute of excellence in radiation protection, will continue to adopt and innovate strategies to ensure that these technologies continue to benefit mankind. The Institute will continue to improve its infrastructure to ensure public health, occupational, and environmental safety in the country. To do this, we need a closer collaboration and effective partnership with our development partners and stake and industry. Together, we can build a very strong radiological safety culture in the country. I would like to take this opportunity to thank our clients for patronizing our services over the years and promise them of our continued dedicated services to ensure safety of their workers, a friendly working environment, and also assist them in obtaining or managing all their regulatory requirements. May the good Lord continue to bless us all, bless our whole land Ghana, and make us great and strong.